Hi, my name's Susanna. I did the flashcard this week on anaphylaxis. Um, the pathophysiology for anaphylaxis is a severe life-threatening systemic hypersensitivity reaction resulting in a decrease in blood pressure, airway obstruction, and severe hypoxia. There's two large amounts of chemicals that are released by the mast cells when this disease process is in effect. The first one is the severe blood pressure drop, and the second one is the swelling in the lungs, and this is a constriction in the bronchi, which in the end causes an obstruction of airway. The lack of oxygen and the lack of blood circulation due to the blood pressure drop can then cause a loss of consciousness. There is a histamine increase and permeable and vasodilation that leads to hyperperfusion of the tissue. Risk factors that puts people at risk for anaphylaxis is food allergies, mostly in children, can be found in adults. Common ones are peanuts, tree nuts, fish, shellfish, eggs, milk, wheat, soy, and sesame. There's also the insects venom, mostly from bees and fire ants. From medications can also cause an anaphylactic reaction, mostly penicillins and NSAIDs. There's also an anaphylactic reaction to latex allergy. Latex is a rubber, mostly found in the healthcare, latex gloves, latex bandage. It can also be found in balloons. And there's also severe environmental allergies. These are allergies that are not um, controlled, mostly trees, dust mites, grass, cats, and dogs. Some major signs and symptoms, tingling, warmth, hives, difficulty breathing, coughing, wheezing. Cardiovascular wise, there's a decrease in that blood pressure. In the central nervous system, you have anxiety, fear, dizziness, loss of consciousness, that lack of oxygen again to the brain. It causes the blood pressure to drop, and the swelling of the lungs causes the airways to shut off. Ways of treating this is by diagnostic testing. There's a skin test where there's a small amount of liquid that's dropped on the surface of the skin and scratched. The patient then waits to see if there's a reaction. The best way that diagnostic testing is unfortunately by trial and error. A patient unfortunately will eat the peanuts and then will start feeling the throat closing, the dizziness, the loss of consciousness. And for treatment, there's epinephrine, the EpiPen, and Benadryl. Thank you so much, and I hope you all enjoyed the video.